Hey there, it's Dr. David Hilton from the Department of Medicine at Hennepin with another of our walking tours of Hennepin Healthcare's new Clinic and Specialty Center. This beautiful building opens on March 26, 2018. Today, I'm standing on the third floor of the new building, and as evidenced by the giant 3 on the wall. And just like in the old building, the third floor is largely dedicated to rehabilitation services. So we're going to talk about that today. When I say rehabilitation services, I'm talking about physical therapy, occupational therapy, speech-language path, things like that. Traumatic brain injury, that's all going to be here on the third floor of the building. So in order to see what new facilities these professionals have to work with for the good of our patients, let's take a look, and let's start with the physical therapy gym. I can see it from where I'm standing. It looks awesome. So now I'm in the physical therapy gym. Hagel, what's this?
Well, it's one of our new equipments that we purchased, and I'm just trying to get it ready for the new building.
Perfect. I'm talking with Hagel Brandeis. He is the physical therapy supervisor in the outpatient clinic and a physical therapy yourself, right?
Yes, I am.
We're in the gym here. It's a beautiful space up here on the third floor. Tell me what you're going to be doing in here.
First of all, I agree, it is a beautiful space, and so we're really proud that we're getting a large PT gym, and the things that we're going to be providing for our patients here would be seeing various conditions such as musculoskeletal pain and injuries to various parts of the bodies. We'll see people with traumatic brain injury, spinal cord injuries, stroke, sports injuries, work injuries, and a whole lot more.
You run the gamut. So what could you do in this space, which I do, it's sweet. This is a nice space. What can you do here that you couldn't do over in the old place?
So one of the main attractions for our large PT gym is we have a new robotic gait and balance system. And so what this system entails is that we'll be able to harness patients onto this robot, and it'll help with their balance and coordination, especially if they have any weakness in there. And it'll provide confidence in terms for them to participate in the earlier recovery process.
It strikes me how open it is, and that the designers put floor-to-ceiling windows. It seems like if you're getting better, you're trying to recover, to be in such a nice place like this might make patients, it's a really comfortable place to do your rehab.
It certainly is. A nice expansive space with lots of natural lighting coming in. It kind of provides a nice natural healing environment for our patients, and hopefully we'll be able to motivate our patients and therefore have good outcomes for their rehabilitation process.
So Hagel, from the gym, we're back into what looks like a huge clinic space. What are all these treatment rooms for?
Well, I'd like to let you know that we are definitely excited, not only with our large PT gym, but our also large treatment rooms that we have now in the new building. Not only will it provide space for our patients, but also privacy. And also we'll be able to dedicate these rooms to some of our specialties, such as women's health, vestibular, lymphedema, neuro rehab. So we're definitely excited, and we can't wait.
Terrific space, Hagel.
That is true. I couldn't agree with you more.
All right. Let's go check out occupational therapy now. So this is occupational therapy, and to help me out, I have Ruth Gromek here. Hi, Ruth. What's your job at Hennepin?
I'm the manager of occupational and physical therapies.
Great. Where are we?
We are in the new hand therapy clinic. This is where we see our hand patients.
So what do you mean you see your hand patients?
Well, anyone that has a finger, wrist, elbow issue, it could be arthritis, cumulative disorders, post-surgical disorders, whatever it may be, we see these patients here.
And then you have, so this whole room is for hands, and then you have a whole nother gym for the rest of your occupational therapy needs, right? Can we go check it out?
You bet.
All right, let's go. So this is the rest of it. Whoa, it's like we're in a kitchen. What room is this, Ruth?
Well, this is our occupational therapy gym.
This is a gym?
This is a gym.
This is the cleanest stove I've ever seen. Like, can I make a pan of cookies or something?
We sure could.
Could we?
Only if you make them for me.
Okay, so it's the gym and we have a stove. Tell me what really goes on in here.
In occupational therapy, what we do is we focus on functional living skills. So we need people to be able to take care of themselves. If they have a brain injury, do they have the skills to cook a meal safely? Follow the directions. We also work on visual processing. Right?
I've heard we're doing all kinds of cool things in visual processing. What is it?
Well, you hear about TBI patients, mild, moderate TBI patients. Many of them have visual issues. We have state-of-the-art equipment that can work on visual processing, reaction time, coordination. We also have a drive simulator for those patients.
Like a car, a driving simulator?
Yeah, it screens and wheels and brake pedals.
Oh, I hope I wouldn't flunk that. So did that all happen in here in the gym?
That will happen in this area,
And I also noticed you have like like a bathtub in there.
We do.
What's going on with that?
Well, you have patients that need to get in and out of a bathtub at home or take a shower, get on and off the toilet. We need to make sure they're safe and independent in doing so.
It looks a little old school, like you have to jump in there and everything.
You actually do. We make our patients go through the motions.
Because that's what they're doing at home.
That's right.
So is the visual happening in here too, the visual monitoring?
Yes, yes. We will have the 4 different pieces of equipment in this gym, so that way we can have people trying different types of processing activities.
So you mentioned TBI. Are we close to the Traumatic Brain Injury Center?
That's what makes us happiest. We are near the PM&R clinic, TBI. We have pediatrics on this floor, and we'll see pediatrics later, as well as orthopedics and medicine clinics.
So the 3rd floor of the Clinic and Specialty Center, this is where rehab's happening. Okay, so now we're going to check out the services of speech pathology, and that's this space. And I asked Sally Degorski to help me out. Sally, where are you?
All right. Hi. Hi, Dr. Hilden.
Sally, good to see you. Tell me what you do.
Okay, I'm the manager of speech pathology at HCMC.
And this is your space.
This is our space.
Tell me about it.
All right, so we have this location features 6 private treatment rooms for adults who are going to be getting services with our team. So we get referrals from the Traumatic Brain Injury Clinic. We get referrals from patients who are recently discharged from NAP rehab. And actually, we get referrals across the whole Hennepin system.
And what kind of things do you do for them in the private rooms?
We work closely on their cognitive, restoration of cognitive skills, cognitive linguistic skills, speech skills, language skills, maybe not so much swallowing in these rooms, but really a focus on speech, language, and cognition.
And then you said an exam room.
Right, we do, and it's just right over here.
Mm-hmm.
So
what goes on here?
This exam room will be the focus of our work with patients with voice disorders and with swallowing disorders. So one of the features in this room is an endoscopic workstation. So
time out.
Yeah.
Endoscopy.
Right.
In speech.
Right.
Sounds very intriguing. What do you mean?
Right. So we have one person who specializes in voice disorders, so she will continue to do video stroboscopy evaluations of the vocal cords. And then the other test we can do with the same workstation is an endoscopic eval of swallowing. So it's different than a modified barium swallow study. It just happens right here in this room.
So you do that up here, but we
Yes.
also still do modified bariums, right?
Yes, and so that'll be down on the 1st floor. We have a brand new fluoro suite down there, so we'll continue to do outpatient modified barium swallow studies there. We'll also continue to collaborate with otolaryngology and go up and see patients in their clinic, especially those patients who had a laryngectomy and have a voice prosthesis, or patients with trach tubes who need a speaking valve, the Passy-Muir valve. And then we'll continue to follow patients in the cancer center. So that's the patients who are undergoing chemoradiation for head and neck tumors. So that's our goal.
It's sort of like the example of collaborative care. You're working with people all over the building, but they're all here in the same place.
Definitely. It's just going to be excellent to have a person come to one floor and get most of their services.
Can't wait for March next year.
Right. It'll be fantastic.
Thanks, Sally.
Oh, thank you, Dr. Hilden.
So we're going to head over to Pediatrics because there's a rehab space in the Pediatrics Clinic. I can't wait to check that out. So now I'm right adjacent to the Pediatric Clinic in the Pediatric Rehabilitation Gym. And joining me are Hagel and Ruth and Sally from Physical Therapy, Occupational Therapy, and Speech Path. So that's kind of mind-blowing. We're in the Pediatric Clinic and we have all these rehab services sort of embedded. Sally, tell me what's going to go on in here.
Yeah, so we have Peds Rehab will be housed in this area, and we are adjacent to the Pediatric Clinic, which is just fantastic for future collaboration. So this is the gym where we'll be seeing, PT and OT will be seeing pediatric patients from very, very little kids up until the middle school years. So down the hall, we also have some individual treatment rooms. 2 of the rooms are set up to focus on infant, toddler feeding issues. Another room is set up to focus on sensory issues, especially those that are addressed by occupational therapy. And then we have a mat room for the physical therapist. And then we also have a room that's going to be set up for older kids, and then we have another regular treatment room. And they all can be interchanged between PT, OT, and Speech Path. We also down the hall have 2 rooms that are set up with observation windows. So if it's better if the family is outside of the room, then we will be able to accommodate that. So we're really excited about our opportunity here in the specialty center. And we're really looking forward to the move.
Wow, so state-of-the-art facilities for the best staff in rehabilitation services in the Twin Cities. That's what I think.
Thank you.
So we have occupational therapy, physical therapy, speech path, traumatic brain injury, adults, kids, all here in Hennepin Healthcare's new Clinic and Specialty Center opening March 26, 2018. I can't wait.